Welcome back to the YMyHealth Podcast, everyone. I'm today's co-host, Melissa Schenkman, and today we are going to be talking about a very important topic, which is genetic screening that we all don't hear enough about and definitely need to know about. And we're so thrilled to have an awesome guest with us, Natalie Sampson. She is a board certified genetic counselor who is devoted to transforming healthcare through offering a personalized integrative and preventive approach to genetic counseling. And she's the founder of Golden Genetics, as well as a certified integrative health coach. And you are currently completing your certification in integrative and functional nutrition as well. So we are extremely excited to have Natalie here with us.
Thank you so much. I'm excited to be here.
Thank you. Well, just kind of wanted to start with what initially drew you to the field of genetics and made you to
Mhm.
decide um, to pursue a career in genetic counseling and testing.
Yeah, so I didn't actually know genetic counseling existed until later in my undergraduate degree, which is not uncommon.
Yeah.
It's such a niche field, and I tend to find that most genetic counselors. I think it's getting better now, but the
Mhm.
awareness, it was little when I was an undergrad, and
Or
so. I had always been obsessed with just understanding the human body and really going into the micro scale. I loved cellular biology because of just understanding, how cells interacted and everything in the environment interacted with our cells. And then I took genetics and I realized genetics is even more micro than cellular, and it was blowing my mind. I remember being so excited to learn in my genetics courses that I would be calling my mom after, like, this is my calling. I found it. So when I was in my studies, I was pre-med and I wanted to work with patients. However, I didn't really necessarily want to go into medical school, and then I was in a lab because I was doing genetics in a lab, but that wouldn't bring me closer to patients. And so someone came and introduced me to the concept of genetic counseling, which is really about being with patients and the counseling component, but then talking about the science of genetics. And I was like, oh my God, this is exactly what I want to do. So from there, pursued it, and kind of went through different specialties, but overall, just was so excited, and I'm so happy that I ended up doing that.
oh, we're so thrilled to hear that. It's a great story on how you found your calling in this
Yeah.
area, and it's such an incredibly interesting area. For those who are not familiar with genetic testing, what is a genetic counselor and what can they do?
Yeah, so genetic counselors have a master's degree in both genetics and counseling. And so I would say, it's not necessarily 50-50 split, but we do have a lot of training in psychology, which I think surprises a lot of people.
Yeah.
But and then the other piece is obviously understanding the genetics to its core. And so the reason we have that psychology training is because when we're doing genetic testing,
Mm.
sometimes this information, not only is it complex, so we need to understand how to communicate that hard science into not into, we say, more patient friendly terms, or just in a way that people can understand because it's so complex. But then also it can be emotionally charged. We have different specialties we're trained in. So that ranges from prenatal to preconception to pediatrics to adult. And, sometimes we are giving diagnoses, and this information can be heavy sometimes, especially when delivered in, not the best way. And so I think that's my favorite part about genetic counseling is that our training allows us to counsel the patient with psychology and also understand them just from a human aspect. And we have time with patients. So most of the time, genetic counselors are given an hour in session, which is amazing because, as we know, unfortunately, our healthcare system sometimes it makes it hard to see patients for long periods of time. And so just having that ability to be with the patient throughout that delivery and that conversation, and even just involved with their family and how they share this information to their family, all of that is a huge component of it too.
That's extremely fascinating, and I think so many people, are gonna really be learning for the first time about that combination between the
Yeah,
psychology and genetics as part of the training, professionally, and
totally.
that's extremely interesting and helpful
Yeah.
to hear.
Yeah.
When would someone work with a genetic counselor as opposed to working
Mhm.
with their physician?
Yeah. Yeah, I think this is a great question. And I think that it's not about, you know, it's really about collaboration in the end. So we really appreciate working with providers. And so our piece is providing the genetics expertise and the counseling, and then handing that information over to also make sure that the provider feels like they can continue with clinical management. And so genetics is so not only complex, but it has evolved so much and it evolves every day. It is almost
Right.
impossible to keep up on every gene that's identified every day and all the different tests and how if we can use insurance and all these little questions that we're trained to follow as genetic counselors. And so that's I think, also a big piece is that physicians already have so much going on that they need to follow with the patients. And so our job is to really take that piece of it, the genetics piece, cover that for the patient and family, and then work with the provider as well so we can be a bridge. We're not expecting the patient to play telephone and try to communicate
Sure.
all the genetics information to the provider. And so I think that, a lot of times it's complementary when we're able to really collab and kind of help the patient in different ways.
Oh, absolutely. And if you could describe for us kind of how you can work with the physician, the two of you working together and kind of helping the patient navigate their
Totally.
healthcare decisions of what that looks like.
Great question. Yeah. So, for example, if an individual was going to do cancer genetic testing because they have a family history of cancer, we would be able to help support the patient. First, we usually meet with them in an initial session to review personal and family history and also provide genetics education to the patient. And then this helps us also identify which genetic test would be best for them. So that's often a missing link when people skip using utilizing genetic counselors' knowledge, because oftentimes, unfortunately, the wrong genetic test can be ordered, or patients don't even know what genetic test was ordered on them because they weren't explained appropriately. So we go over that in the initial session to make sure there's a mutual agreement on which genetic test can be ordered. And then when we get results back, if an individual does have a change, also known as a mutation, in a gene that increases their risk of cancer, for example, we will talk to them about everything we recommend. And
Right.
then we'll also send this information to the provider. So, for example, and I'll probably get into this a little later, but
Yeah.
if someone has an increased risk for breast cancer, there may be a recommendation for increased screening, such as mammograms or breast MRIs. And so then the provider is able to have that in their system and talk with the patient from a clinical management perspective and help them get those screenings and follow through with them with years to come. So that's an example of, how we may work together just kind of from a cancer perspective and screening perspective. Of course there's so many layers, but that
Sure.
is like what's really helpful.
No, that is very helpful to hear, very comforting to hear because I think a lot of our listeners are going to be wondering how would that partnership would they be so much of the healthcare system is is siloed. And so it's
Totally.
wonderful to hear how would and the partnership just in everything as we've all learned, especially throughout the pandemic, makes such a difference. So that's really helpful to hear.
Totally.
Typically, kind of what in your experience so far, what are some of the main reasons people under age 50 first really even learn about genetic testing? And then what are some of the most common reasons they pursue doing the testing and screenings?
I would say a lot of people under 50 learn about genetic testing. I think it's changing. So I think a couple years ago, people first were introduced to genetic testing potentially in preconception or prenatal. And so this is when, women would during pregnancy maybe be offered, a lot of times providers will call it the gender test. It's NIPS, but in reality, that's actually checking baby for chromosome abnormalities such as Down syndrome. So that's just a genetic test that's usually offered to pregnant women. Sometimes women are offered genetic testing for preconception. However, I think that the genetic testing world has changed so much to where direct to consumer companies have come out
Yeah.
and ancestry type tests, have taken over. I know we all know about the recent updates with 23andMe, but a lot of people who come to me now will actually come to me from hearing about genetic testing from Instagram or an online genetic test.
Interesting.
Yeah, and it's difficult because not all genetic tests are created equal, and
Mhm.
unfortunately, there are a lot of genetic tests that exist out there that are direct to consumer that aren't the best. And so, that's a big thing is this a lot of companies have turned this into a business, and I totally understand, business aspects, and I do always remind patients that the best way to do genetic testing is through an individual who specializes in genetics, obviously genetic counselors. But, just being aware that not all genetic tests are created equal, and some genetic tests can give results that may not be the most accurate or helpful.
Mhm.
And so we oftentimes will see patients who come in with results that we don't interpret just because they don't actually make sense to the patient's health. And so we'll retest them. But I'm tending to find that people are kind of hearing about genetic testing in those avenues, if not preconception. And then sometimes, if we're lucky, someone will be told about genetic testing if a provider notices something on family history and they're able to be proactive with it. But of course, there's times too when there's a diagnosis in the family. So sometimes we'll get those to cases as well.
Extremely interesting. Yeah, no, definitely better to start with getting an order from your doctor, being in partnership with a genetic counselor, because there's so even to your point, there's so many genes.
Yeah,
There's so
we have
many genes.
twenty
Yeah,
thousand genes. Yeah,
right.
over.
And the information could be overwhelming
Yeah,
that that
100%.
that you receive if you're not getting the correct counseling
Exactly.
from genetic counselor. And far as the process, kind of what does because I think that's something that a lot of people don't really know either, is what
Yeah.
does the genetic screening process typically involve?
Yeah, and I think it's a lot maybe simpler than people think.
Yeah.
We've actually come to the point too where we are able to use saliva or a cheek swab sample and have accurate DNA results. It depends. There are certain specialized cases where we still need to use blood, but that's a misconception I hear all the time is, oh, but it's not as accurate if I use saliva. And there are actual, labs that we can use that can take saliva samples and accurately sequence the DNA. So I think even just providing the sample, but we always, because there's so many specialties and so many
Yeah.
indications and so many genes, like you said, which means there's so many genetic tests. And so that's why we always start by doing the personal and family history. Because, for example, someone may come to us for preconception and they're looking to start a family. And so we want to consider doing something like carrier screening to assess if them or their partner could pass something down. But then we're doing family history and we see maybe there's an extensive family history of cancer, and it might be something that they want to consider to add on doing cancer genetic testing as well to allow them to be proactive for themselves. And so we always start with that to make sure we're selecting the appropriate test or tests. And then once we receive the results, we will interpret them and review them. We'll have a session where we go through the results, and then we develop an action plan, especially for my practice. We prioritize empowering the patient rather than leaving them with just the lab results and kind of sending them off with risk information. We always give them an action plan so that they feel comfortable with the information and they know what to do with it.
So that's wonderful to hear, and it really leads beautifully into my next question for you is about your approach, because you have such a unique approach to genetic counseling, and that it's integrative. And integrative
Yeah.
is really very much integrative medicine. And so I was wondering, kind of like, if you could tell us a little bit about what an integrative approach to genetic screening can look like.
Totally. And I always like to start off too by defining a little bit of what integrative is, because I
Absolutely.
think people know about it, but some people I think have misconceptions or misinformation about it. So, integrative in itself really means that we are taking the best of Western conventional traditional medicine. So, that's things like screening surgeries, pharmaceuticals. And then we're also taking the best of more holistic practices and combining them so that we're looking at the patient from a whole person care model. So, I think that is so important because none of these pieces exist in isolation. And for example, when we're talking about cancer risk to someone, of course we want to talk about screenings, and we also know the importance of things like nutrition, lifestyle, and stress, for example. And so, how can we combine these worlds to really support the patient and recognize that people, don't exist in boxes, but these complex systems. And so that's what really, I became really interested in integrative healthcare and applying that to the genetic counseling world because I previously worked in oncology and neurology, so dementia and Alzheimer's as well.
Oh,
And,
wow.
giving risk information to people who didn't have diagnoses yet, but their family members had. And so I realized, we're not really talking about all of the other aspects of health that is so important to the person. And so that's why I really wanted to start my practice so that we're not replacing or forgetting all the important things that exist in more conventional medicine, but we're just adding to it to support the patient in a different and in my opinion, better way.
Oh, absolutely, absolutely. And how does that kind of play out when it comes to, if you could give us an example in terms of like when you have been working with patients in terms of your approach as well? I know you were talking about some of those things holistically, so if you could talk a little bit about what the integrative part is too, that would be great.
Totally. Yeah. So, we'll start with cancer because so in cancer genetic testing, normally we can assess if someone might have an increased risk based on their genetics. And
Mhm.
so, when we're not approaching it from an integrative perspective, if someone comes back with that, I know I addressed this a little bit, but sometimes we will talk about, of course, we'll talk about screenings, but sometimes we even will talk about surgeries and pharmaceuticals
Mhm.
depending on what the gene mutation is, so that
Okay.
they can be proactive. But the kind of missing piece there is prevention and
Yeah.
also, what other factors in our environment can contribute to that risk and how can we be preventative in those other aspects. So, for example, nutrition, how are you eating? What are you eating? We can look at the research on what has been known to be more preventative against cancer.
Gotcha.
And then same with lifestyle. And I do like to use nutrigenomics, which I know we'll get into probably a little
Yeah.
bit.
Yeah.
But I will use nutrigenomics in those two cases too to kind of personalize even further the nutrition lifestyle components. And then also, of course, sleep and stress and these other components too, which a lot of times, we all hear okay, we have to sleep better, or okay, stress is bad for us. But what are the actual action steps you can take if you're feeling stressed? Like, can we even just get in a 10-minute walk in your day? I think some people don't even have the guidance to go through their day and just go through what can we take out or add, even if it's so small, that can help from with that little piece. And I think that helps people really also feel empowered instead of, oh my God,
Yeah.
I have this cancer risk and I'm doomed, which is not the case at all. There's a lot of, oh my God, I have this cancer risk and there's so much I can do about it. And I can also get ahead of it. And so it's taking the lens from, fear to empowerment. If that
Oh,
makes sense.
that's absolutely wonderful, and I think so many of us in our generation are looking for that, given kind of the current climate, which we're gonna talk about too. And speaking of the nutrigenomics, I super interested. So,
Yeah.
for those who are listening who are not familiar with that term, nutrigenomics is the scientific study of how genes and nutrition interact with each other. Super interesting area of genetics. Um, nutrition and our dietary choices in particular, that is a very hot topic in our generation. We're always looking at what we eat and what is in it and trying to avoid different things. So many different, artificial flavorings and things like that, that maybe for most of us when we were growing up, this was not even a factor. This was not a factor for our parents because we didn't know what the research is telling us now. And
Yeah.
so just really out of curiosity, because there's so many people with so many different things, and I'm going to speak to those in a moment. How is nutrigenomics used to tailor diets based on genetic predisposition to things like gluten sensitivity and metabolism or cholesterol, which are all big concerns for the community?
Definitely, yeah. So nutrigenomics is kind of its own world too outside of medical genetics. And again, like I mentioned before, there are a lot of companies that offer this type of testing that aren't the best. So you do
Mhm.
have to be really careful in the companies you select. But with that being said, it can be so powerful when you use I use a specific company that I really love and trust. It can be really helpful in helping us understand how you personally may respond to things. And I think this is to the environment around us. And so the person I actually trained under an expert in nutrigenomics when I first entered the nutrigenomics field
Oh,
because,
wow.
because it's so different than our kind of single gene medical genetics. And the person that I trained under really actually refers to the tests that I use as lifestyle genomics because
Mhm.
we're looking at more than just how food interacts with your body. We can even see, how things that you're exposed to or practices that you might do, for example, like a sauna, may interact in your body. And so it can be really helpful in understanding that. And so to get more specific, so yeah, so gluten sensitivity and celiac is definitely a piece of it. We do test for the HLA genes. And these genes actually are in charge of dictating how our immune system will respond to gluten antibodies. And so this can be really helpful because if we know that our body's more likely to respond in an immune reaction to gluten, there's kind of a layer system. If you're
Yeah,
really at high risk, then people can understand and cut out gluten without having to do an endoscopy, for example, to figure out their celiac. And what's cool about the HLA genes is if you test negative for them, you actually rule out celiac because they are immune system genes.
very
And so,
cool.
yeah, so that's a piece. Cholesterol is really interesting too. So, I always like to talk about this one gene called ApoE. ApoE is kind of a buzz gene too that
Yeah.
has been talked about actually due to its link to Alzheimer's risk. But a lot of people don't talk about the cholesterol piece of ApoE, which I think is really important. So, ApoE is actually in charge of cholesterol management and cholesterol transport. And so, there are different versions you can have of this gene. And so, some people have a higher chance to have actually really low cholesterol and low LDL, and this is actually preventative when they have this change. It's preventative against heart disease and Alzheimer's. Other people have the opposite, where they have risk of having really high LDL and issues with cholesterol, as well as higher risk of Alzheimer's and heart disease. And so when we're getting specific about diet, of course, we're going to address the risks. But one thing that always comes up for me with these patients is that a patient may come in hearing their favorite influencer talking about the importance of how great keto is and saturated fat. And they may, want to try this. But when we look at their genes, and we look at other genes in cholesterol too, but like let's say they have ApoE and they have high risk of high LDL and they're not processing those fats the same, that diet may not actually be really helpful for them. But on the reverse, if someone has the other type of change, that diet might be really helpful for them because they're so predisposed to having low cholesterol that increasing their LDL is actually probably good because we know cholesterol is also a precursor to hormones and vitamin D. And so that's an example of how interesting and helpful this information can be for people when they're trying to understand kind of these general things and kind of these extremes they're hearing online. In the end, I always say it's really about your genetics and what's personalized to you. And so that's what I think is so amazing about combining the nutrigenomics with this maybe more medical genetic testing. And when I say that,
Yeah.
the biggest difference is also when we're doing medical genetic testing, we normally are looking at genes in isolation. Whereas when we're doing nutrigenomics, we oftentimes are looking at the genes and how they're working together. We call that a systems biology approach. And so they're different approaches, but when we combine them, that's when I think there's a lot of power in personalizing prevention and also in general your health.
Oh, 100%. And that's such an excellent example to illustrate how the combination of learning all of these things, of going in, getting properly screened, And, with a genetic counselor and somebody who has the background that you do in the training with nutrigenomics and bringing that in, what a difference that can make uh,
Totally.
for people. And speaking of what you were talking about, also with people seeing influencers, so that's like a huge issue, as we both know. Really, I'd say throughout public health in so many ways, and in this space in particular, I think I wanted to ask you because, like, as our community is constantly really combated with different advertisements and different for supplements and different influencers, on social media who are eating and drinking different things and using different supplements, in your view, how can we distinguish between what is real and what is hype in this growing field of biohacking, which is this idea of like us using our being able to essentially prevent things on our own through lifestyle changes. Yeah.
Definitely. Yeah, and I think um this is really tricky for everyone, even providers, because not only is there so much information out there, but there's so many opinions and there is so much research going on all the time. So, it's one of those things where it is hard for people to keep up with research. And I think that the biggest thing too for providers is that we I think the best thing for us to do is also stay open-minded and look into it ourselves too. With that being said, what I like to do is, as a provider, really connect with other trusted providers in the space and develop communities where we can chat about research because it's so hard for one individual to
Of
keep up
course.
on research. And then I also like to look into research myself. But for people who, that's really hard, especially when you don't have a science background to read research papers, for example. Um, I would say, and this is, I think, um, maybe not the answer that is expected, but I would say the biggest and best thing for people to do is to listen to their body. Because if they are listening to someone who's talking about a very extreme thing and they try it and it makes them feel terrible, then it's probably not good for your body. And, like I'd mentioned in the example before, sometimes these trends are really good based on your genes
Yeah.
and other factors in your life. But other times they can be pretty detrimental. And so I would say first, always, kind of look into trusted, credentialed individuals for information. Also potentially develop a community for yourself with those people. And then the third is also just listen to your body. Really listen to your intuition. Even I think the body's intuition is much more powerful than we give it credit for. And so, if something feels off or it doesn't even feel like something you want to try and you just are doing it because everyone says you should, you don't have to and you shouldn't. And so I think that's just a big one is I will hear patients come to me saying, I tried keto, it's supposed to be cancer preventive. I feel terrible on it. And I'm like, well, don't do it then because,
Yeah.
when we're not talking about like extreme diagnostic situations, like when we're just talking about people wanting to try things for health, I think that that's a big piece.
No, absolutely. And that's a great rule of thumb to have, not only in terms of how you're feeling, but also to point out, which is something we are just a huge proponent of here at YMyHealth, is finding credentialed individuals
Yeah.
to guide you and
Yeah.
and following that, as opposed to somebody who does not have the knowledge in the space and is,
Mhm.
suggesting a new diet that they are right. That they are
Yeah.
trying that may work for them, but may not be safe for you. Are there any other examples other than the keto diet that you had mentioned that you've seen or you've read about in terms of nutrition and dietary trends that you think people should be aware of, and look into possibly incorporating to their lives? And then also anything that they should definitely avoid that
Yeah.
you've noticed?
Yeah, well, I'm always hesitant when there are people on the internet who are talking about things in a fear based way or also quick fix type of language. I think that it's always good to be wary of that because, in general, um, you know, our health there's never really a quick fix.
Yeah.
And unfortunately, I am empathetic and aware of the fact that it's hard sometimes to run a business and to market. And I also think like using fear is not always the way to go. And so when people are using fear to kind of convince you into something and you're feeling like you're doing something because you're scared, I always am telling patients to kind of stay away from that, as well as extremes. So in my opinion, after studying, and understanding the body, from my training, I always lean more towards balance. And
Right.
really, can we kind of just get down to whole foods and the basics? Are you moving? Are you sleeping? How's your stress? I tend to see a lot of people kind of jumping into wanting to do these extreme things, which I also, with that said, am a proponent of trying some of these things. Like I love the sauna, for example. And I also think, before we even get to kind of the cherry on top, let's get your basics down.
Yes.
Because I think a lot of people are kind of going around not sleeping well, very stressed, and then they're getting even more stressed because they're trying to try this extreme diet. And it's sometimes we just have to kind of be gentler with ourselves and, start with kind of the basics and then add from there and get personalized again with the genetics. One thing I'll say to answer the first part of your question
Sure.
is that I do think that the research on things like the Mediterranean diet and anti-inflammatory diet is really strong. I would say a lot of people, for the most part, could benefit from a type of diet that has high omega-3s and vegetables and whole foods. And so I think that's a great place to start for anyone. It's not extreme. It's very balanced. It's mostly just focusing on the anti-inflammatory and Mediterranean style piece. And so I think that there's a lot of good research showing that that type of diet can be helpful for prevention and just blood sugar management and things like that for people to feel good.
No, absolutely. That's very, very true and an excellent place to start. I agree with you there for sure. And one of the most pressing concerns that we talked about a little bit in the beginning among the millennial generation right now is this rise in early onset cancers. There have been reports in very reputable journals over the past, I'd say, 2 years that 10 different types of cancer are on the rise in our generation. And for us, we talk a lot about colorectal cancer and why my health, as everybody knows, in that space. And so I, there's a lot of talk about maybe a role of genetic screening in this space as a tool that a lot of people are not using yet, maybe are not familiar with yet, that could be used to really help us fight this. And I know with those that we've talked with in relation to fight CRC, we talk a lot about also undiagnosed Lynch syndrome, which can increase your risk of colorectal cancer. And one of the things that comes up is, which brings in the nutrigenomics piece, one of the big things that comes up with colorectal cancer is about the diet. Those of us growing up in the 80s, growing up in the 90s, who are now being diagnosed with this early onset colorectal cancer that we ate, and is there a connection with that, which is still people don't know. They're researching it heavily, but people don't know for sure yet. When it comes to genetic screening for colorectal cancer and as well as breast cancer, at what ages do you think we should be pursuing this testing?
Yeah, such good questions. And I think a lot of times individuals tend to pursue the genetic testing for cancer when it's too late or later than we want. So ideally, we want to do this genetic testing before anything comes up. And I feel like I saw that as a big problem when I worked in oncology. It's no one, I mean, it's not that we're blaming anyone. It's just
Sure.
that a lot of times we would see patients after they were already diagnosed with cancer. But the power of the cancer genetic testing really lies in the fact that you're able to be proactive with that information. And with that being said, there is so much knowledge we can gain if someone does have a diagnosis because it can help with treatment planning. But I know we've talked about screenings, but I think, a lot of people, if there's family history of colon or breast cancer, I would say 20s or 30s definitely would say probably a better time to consider genetic testing than later in life.
Yeah.
Because some of these gene mutations, like Lynch syndrome, a lot of people have heard of BRCA mutations for breast cancer. Some of these can increase risk and for early onset cancers under 50 years old, even 30s, and I have seen cancer at late 20s. And so if there's a family history of cancer, I highly recommend starting as soon as you can to pursue the genetic testing. And the reason also is because your insurance should cover increased screening for you as well. So it's not like we're just leaving you to try to go pursue out of pocket screening. Oftentimes, if there is that genetic component, you may want to start mammograms at a much earlier age, around 30, for example, colonoscopies too. At an earlier age, I know that the colonoscopy age has changed. And then when
Yes.
you have a genetic component, it's even earlier than the general population. And so,
Yeah.
I know we've talked a lot about like screenings, but the reason that they're so beneficial is because we know cancer caught early is so much better than cancer caught late. If we can catch cancer at stage 0 or stage 1, a lot of people don't put that into their mind of what that means, but it usually means that they can remove the early tumor with surgery instead of having to do chemo or radiation. And sometimes, if it's caught too late, there are not even those options. And so, if something is found, it's caught very early, it's kind of just a blip and it's taken care of versus having to go through so much extensive treatment. It's a very different picture. And so, if we're able to catch it early, that's huge. And then on top of that, as I mentioned, like we always love to layer on how can we also prioritize other aspects of your health to be preventative even further. And so that, can be huge. And as we're figuring out and understanding the why behind why we're seeing early cancers,
Mm.
I think the best thing to do is take control and understand your personal risk and then understand what you can do about it.
Oh, absolutely true. And from the kind of the nutrigenomic standpoint, how can the results from both getting genetic testing regarding, like you're talking about with BRCA, with colorectal cancer, and with breast cancer screenings for these genes early on in the 20s or in the 30s, once you get those results, how can they inform our dietary choices for prevention as we're moving forward in partnership with a genetic counselor like yourself?
Yeah, I love this question, and it's honestly one of my favorite things because when we understand the medical genetics and we get the screenings in place, and then we're able to kind of personalize everything else with nutrigenomics, I always feel like it's so fascinating for the patient, empowering for the patient, and really interesting. So, when we're doing nutrigenomics, we also will look at different pathways in the body, which I find fascinating. So that would be like inflammation, oxidative stress, detoxification, methylation. These are kind of misunderstood pathways, but they're really important pathways in the body. And indirectly, when these pathways are in dysbiosis in the body, they won't support an environment that's cancer free. It will kind of support an environment for cancer. And so we have to look at the patient's pathways and see if we can help them um, kind of optimize them in a way. So, for example, if someone has different variants in their inflammatory pathway and it makes them more likely to respond to inflammation in the presence of inflammatory triggers, then we want to assess one, can we support your environment and diet to be more anti inflammatory? And then two, is there anything additionally we can do to keep that inflammation down? But someone else might have issues with phase 1 or phase 2 detoxification. And so then it's like for phase 2 detoxification, that means maybe someone has a tough time removing chemicals and toxins out of their body. So, how can we support phase 2 detoxification? Things like cruciferous vegetables and sulforaphane can help
Mhm.
upregulate that. And so that's where we can say, okay, this person may have an increased risk of cancer due to a mutation in these genes, like the Lynch syndrome or the BRCA genes. And then can we support these other pathways in that sense? And then also, in nutrigenomics too, we'll look at other things like hormonal pathways as well as glucose and insulin pathways. So, like if someone is predisposed to diabetes, we really want to ensure that each meal has protein and fiber to
Right.
stabilize that blood sugar. And of course, we love to work with dietitians with this information as well and approach it in both ways. But I think, those are examples of how we might support someone with both of those tests.
That's extremely interesting, and also interesting to point out that you also collaborate with the dietitian,
Yeah.
as well. That's
Yeah.
very exciting to hear between your physicians, your genetic counselor and your dietitian, you can be set.
Yeah, exactly.
That's no, that's absolutely, absolutely awesome. Well, as we wrap up this amazing conversation on this episode, how can genetic screening be a tool in our fight to prevent these early onset cancers? And really, how should we be talking about genetic screening with our healthcare providers and with our friends?
Yeah. So genetic screening gives us a head start and it really shifts, it allows us to shift from reactive to proactive care when we're able to do the genetics before anything comes up. And I think that in itself is amazing that we even have the tool to do this and the tools to do this. And so I think just even normalizing these conversations, and talking about genetics and the importance of genetic testing with friends, and even bringing this up to providers and seeing, I think, of course, we see patients virtually. And I also want to note that I think genetic counselors and genetic testing might be more accessible to people than you think. So you can also ask, your provider, your PCP or your primary care physician, and see if there's any genetic counselors that work at the hospital or the healthcare system you're in, because sometimes there are, and maybe you didn't even know about it. And then of course, I always like to say, when you meet with a genetic counselor, it's never about pressuring you to do the test, but it is so helpful to talk about the benefits and limitations to you. And like I mentioned, the cancer genetic testing is such a powerful tool to be able to not only be preventative, but also proactive and personalized. So it kind of gives you all the three amazing, things in healthcare. And so I think, yeah, if we're able to really just normalize this more, talk about this more, it won't only be more accessible for us, but also future generations too.
Oh, excellent, excellent points. And we all should definitely work to do that. And I'm sure as everyone's listening, they've learned a lot. I know I certainly have in talking with you. If any of our listeners would like to connect with you and to work with you and your team, since you have the option virtually, how can they reach you?
Yeah, so highly recommend reaching out. We love to connect. And if we can't help, we always connect you to someone who can, because we just want to make sure that you're getting the best care. And so definitely feel free to email me at Natalie, Natalie, at goldengeneticshealth.com. And then you can also visit our website at www.goldengeneticshealth.com. And then our Instagram is the same as well, which is at Golden Genetics Health.
Awesome, awesome. Well, thank you so much, Natalie. This has been an amazing conversation.
Thank you so much for having me.
You're so welcome. And just wanted to let everyone know, if you enjoyed today's episode and you learned at least one thing, and I'm sure many, many more, I can say for certain, please subscribe to the Why My Health podcast, and share it with your friends and family. And also, we would love if you would write us a review as well. That helps to take and spread the awareness of this incredibly important information. We appreciate that. But thank you again, Natalie.
Thank you.